So welcome. I'm so excited and a little nervous for our very first live stream. And I'm really, really honored. Richard just told me that there's like over 200 of you currently on. Hopefully some more of you will join later on. But this is just such a wonderful opportunity to be able to thank you and to thank you for following our videos. But also, I also want to say that I want to thank you for all your comments in the videos that I produce. And most of them are like just so kind and so supportive. And I wish I could answer all your comments, but I'm not able to. I have a busy practice and I produce these videos and I make time every day to exercise. So those are my priorities. But I do read them and I do want to thank you. So hopefully today, we'll address some of your questions, and these live streams will be an opportunity to at least have a dialogue on this level. So just want to introduce you to my home a little bit. Whenever you see the videos that we shoot, it's literally just taking this camera and 180 degrees the other way, where you see the fireplace, and that is our dining room. And then if we just shift the table over, behind us is the living room. You'll notice I don't have a coffee table. And I never have had a coffee table. My kids would often wonder why we didn't have coffee tables. But I like to have the open space. And now when they come and visit, that's still their space and my space to be on the ground and doing our stretches. And so every day, instead of sitting in chairs, I generally sit on the floor. And I'm ensuring as I get older that I can get up and down from the ground, which is an important part of fall prevention, which brings us to our talk today, which is chatting about balance and fall prevention. My studio where I see people, or my physical therapy practice, is just beneath us. And the person I want to introduce you to is just up the stairs, and his office is up there. And this is my husband, Richard. We have just celebrated our 35th wedding anniversary. And during that time, produced two amazing kids. So they're everything in our life. Beyond our third child, which seems to be YouTube now. So I'm going to turn this over to Richard to share some important things before we start on the main topic of balance and fall prevention.
So thank you, Margaret. So I'll take over and I'll bring you back a little bit later, okay? Thank you. So welcome, everybody. Welcome to the live stream. I didn't know I had a new child called YouTube, but it's news to me. My role is to produce all of the content that Margaret generates and get it onto our website and also on our YouTube channel. Before I start, I want to cover a couple of things. One's a little bit boring, which is basically that this live stream and its contents do not constitute medical advice. It is for information purposes only. If you have a medical condition, you should consult your physician or another licensed healthcare professional. Second, I'll cover the agenda and the format and approach we're doing today. So Margaret's going to go topic by topic in terms of balance and fall prevention, and we'll change the banner at the bottom so you know where we are. And once she completes that section, I'll come back in and I'm going to be presenting the questions appropriate for that section and related to it. And then we'll carry on to the next topic and go through that iteration. So I know people are very busy on chat, which is great. Please submit questions and I'll try my best to get them in. I don't know if we're going to get through them all, but we'll try our best. Finally, we will be posting, this will be recorded and posted on our YouTube channel and accessible afterwards. And we'll also post, we might be referring to different, or Margaret will be referring to different resources during her talk. And what we'll do is, if they're mentioned, I'll make sure to get them into the description box when the thing is finally posted. So with that, what I'm going to do is bring back in Margaret and hand it back to her. Thank you, Margaret.
You're welcome. All right, so one comment that came in last night was from a healthcare professional asking if there are CEUs, which is not going to be available, just to let you know. And also want you to know in the 8 or so categories on fall prevention that I'm going to be talking about, each one of these categories can take up hours of time. And I learned a lot of what I'm going to share today from a wonderful resource, and I'm going to share that for healthcare professionals, but since their channel or their recordings are on YouTube, you can find them, and that's the Loop Fall Prevention Community of Practice. So with that, I want to say that falls are not a normal part of aging. So we talk about it and we worry about it because it's a huge issue for our longevity and the longevity of those that we love. And it's a huge burden on our healthcare system because when people fall, they often will fracture and their life changes dramatically. So I'm hoping that after today, you are able to take steps to make sure that falls are not part of the way you age and part of your aging process. So the first thing I think that's really important is just understanding, how does our body balance? And most people don't realize, but there are 3 critical systems that we use. And if you understand these systems, then it makes sense when you see me do exercises on the YouTube channel. You go, oh, that's why she's doing it, because it's challenging one of our systems or taking away a system. So one of those things that you often see me do in a balance is I'll have you standing on one foot, or tandem stance, similar to what just came out on YouTube recently. And I'll say, maybe you should move your eyes from side to side or up and down. And that changes your balance dramatically because our eyes are one of the very, very big systems that we use to help us balance. It gives us an orientation to the horizon. The second system that we use is in our inner ear. And we have 3 semicircular canals, all in different directions, perpendicular to each other, that give us position sense when we move our head. And so that is something that fighter pilots and astronauts have to train for, to not be dizzy when doing their spins. Children love to stimulate their vestibular canals. They seem to just, all the spinning that they love to do. But as we get older, we tend not to. And therefore, I'll hear sad stories like, oh, I was going on the same walk I do all the time, and somebody from behind me called my name. And so I looked back and I fell, because that individual never worked on their balance with head turns. And so they unfortunately fell as a result of that. So that's why when you do balance training, as you get more and more comfortable, you start with little head turns and then gradually bigger head turns in order to stimulate your vestibular system. And the speed, as well as the angle that you turn your head, makes a big difference. Obviously, the further, the harder. The next system that we use in our body are called proprioceptors. Now, we have proprioceptors in our muscles, in our ligaments, tendons, and our joints. And proprioceptors are really noticeable when somebody has a stroke. You realize how much we rely on just knowing where our limb is in space. Because if I move my hand after a stroke, depending on the stroke, the angle of my hand is not perceived. Even if my arm fell off of the arm of the wheelchair, I don't even notice that because of the lack of proprioceptors. Now, we can train our proprioceptors, and we can train them by removing our bigger sense that we tend to rely on, which is our eyes, and that will help us to start forcing that system to communicate more with our brain, to use it as a system, our backup system. Since we rely so much on our eyes, it will force that system to work. But it's so very important that you practice in a way that allows you to succeed and not overwhelm them all the time. So hopefully we'll get into that a little bit more as I address some questions. And so those are our 3 main systems of balance that we need to use constantly. And as some systems start to fail, we rely on other systems. So I'm going to turn this back over and see if Richard has any questions in regards to just our systems that help us balance.
Great. Thanks, Margaret. Yeah, there are actually a couple of questions, and I'll stay on while you answer them, at least because there's several of them. Otherwise, I'm jumping in and out. The first question is, how often should we do balance exercises, and how long for how long each time? Excuse me.
Great question. So I'm a very big believer of doing a little bit of balance every single day. And that could mean 30 seconds, when you're in the kitchen waiting for the kettle to boil. I'm not a big fan. You often hear, in books for seniors or exercise classes, they might recommend, oh, you should work on your balance while you're getting dressed, putting pants on, or while you're brushing your teeth. And I disagree with those things. You could do it. They can be your cues to balance before or after those things, but not during. Because when you're balancing, you actually want to you want to challenge your body enough, just as though you were learning to surf. And so you definitely don't want to be doing this, like this sort of motion, when you have a toothbrush in your mouth, because that's just, dangerous. And in the same way, you don't want to be practicing your balance while you're putting clothes on, because if one foot gets stuck into the pant leg, that's a really good way of A, straining a muscle at the least, and B, even worse would be taking a fall, because you get caught and you can't get your foot out fast enough to stop yourself from falling. So a little bit every day, and if you do it, you want to feel like, oh, I challenged my balance, and I feel that I had to work hard at maintaining my balance, but not that you're overwhelming your system. And overwhelming your system would be that you are trying to take a pose that you see in a video, mine or someone else's, and you can only do it for 2 seconds. Well, then you need to do an easier pose, or move your eyes less fast, or don't close your eyes, or change your foot position, so that you can succeed for at least 15 to 20 seconds.
Great, thank you. So we'll move on to the next question. Is it possible to completely restore proprioceptive functions in seniors? And what are the most effective exercises to do that?
So when we injure a joint, our proprioceptors get injured. So as we age, oftentimes we have an accumulation of little injuries, ankle sprains, hips, hip replacement that obviously will change the proprioceptors in the hip joint. All of that decreased stimulation changes the awareness of your positions in space. And so as we age, just like our muscles, if we don't use it, we lose it. There's some studies I've been reading that it seems like the nerve cell communication in the brain starts to be less, just like you would see, your muscle fibers reduce as you age if you don't use those muscle fibers. So with that reduced nerve cell communication, you have a slower response time, which obviously is something you see as people get older. If they're going to, on the pickleball court, for instance, they're just not, getting that spontaneous movement out there as fast, be it from upper body or lower body. And so so can we regain it? Yes, we can. Can we regain it to the degree that it was when we were 20 years old? Likely not. But you can certainly always improve what you have. And then what is the most effective exercise? It truly depends on what category of the balance weakness that you have, because balance is a combination of, so we talked about all the receptors, but we have strength that plays a role. There's also, strength mainly in the lower body, but core strength is also really critical. We also have the coordination, we have agility, We have all these different components that, you could do agility drills, just like you could do static balance, and you can do strength training. So all of those things are important. And so I can't say one is more important than the other, but depending on the weakness of that individual, that would be the one they'd focus on.
Okay, great, thanks.
Sorry.
And the final question in this section, and then I'll exit, is what are the best yoga poses to support balance and fall prevention?
Okay, so I would say unsupported tree pose, and I say unsupported without the foot resting actually against the opposite leg. Airplane, warrior three, half moon. And so if you're not a yoga practitioner, don't worry about these. Dancers. But the big thing I want to say for yoga practitioners is unlock your joints. So I would say 99% of people who enjoy yoga are hypermobile. I'm one of them. Our joints don't give us feedback. Our proprioceptors are overstretched by the time in our ligaments, by the time we're well beyond, keeping a joint in a healthy position. So keeping your joints in a neutral position, sometimes you won't even know what that is. You'll have to work with a practitioner who does know what that means. And so if I took my elbow joint, and Richard, you can tell me if this is okay here, but I can overextend. So this is hyperextension of my elbow. If I hung out on this joint, I would eventually actually be overstretching my ligaments and not doing any holding with balance. So if this was my knee, and I see this a lot in yoga practitioners, they will just lock out on their joints. They're not helping their muscles in any way, nor are they teaching their joints to maintain good position sense. So then coming to a more neutral position is much healthier. So I hope that helps with that question.
Great. So I'm going to exit now, and then I'm going to hand it to you, Margaret, and you'll move on to the next topic, and then I'll come back in when you call me, okay, for the next set of questions.
Very good.
I'll see you soon.
Okay. So the next topic is foot care. So foot care has been a passion of mine, since I turned 50. I realized, oh my gosh, I have to really, when they were talking more minimal issues, and we have to look after our feet more, because I was noticing that my balance was starting to change as well. And I thought, maybe I can harness the power of my feet. So first of all, you take care of plantar warts, you take care of corns, you take care of calluses, ingrown toenails, hammer toes, bunions, all those things. And that's where then you start. And then you start with, regular foot massaging, regular stretching of your toes, regular strengthening. And I have shorts, I believe, YouTube shorts on all of those. So they're just a minute long, just to, give you a sense of that care for your feet. And that's really, really critical. So in a nutshell, if you are unsure if you have healthy feet, then have a foot assessment. Podiatrists are trained in foot care and know their job really well. You don't have to go and see them because you want an orthotic, and often it's best to see them before you even are considering an orthotic, but rather just go and see them for the health of your feet. Richard, I'll let you tell me if there's a question, otherwise I'll move to the next section.
In terms of foot care, so yeah, there is one on foot care, and it is, please advise on bunion balance issues.
Bunion balance issues or balancing with bunions? Or
I'm just using the wording that the person used. So, Marcus, it's up to you to interpret what that means, but I do think she has bunions and she's having balance issues. So,
okay, all right.
Is that fair?
Yeah, so hopefully the bunion is in early stages and can be easily corrected, because it's really, really important to try to avoid having surgery for your bunions. And so going back to the massage, the stretching, and the strengthening, you can do the exact same thing for your bunions. And, actually I was doing some search the other day in preparation for this, because I haven't done yet a YouTube video on bunion care and but there are some physical therapists that have, and they're good. But essentially going back to the principles of massaging, all the muscles around the first ray, which is the first long bone of the foot, and in the space between the first and second toe, both bottom and top. And sometimes we can take, because there's not a lot of space to get in there, you can actually take one of those pink erasers from when we were kids, and the triangular edge, that's a really nice massage tool to get into that space. And then stretching, just the way if I had a tight thumb, if I was going to stretch my thumb away, there are devices that you can put between all your toes that will help you stretch your toes. There are, even just the cheaper ones, or sometimes there's actually on the market now so many different silicone ones, ways to stretch your toes. And then I have, as I said, some YouTube videos on toe stretches. And then you want to start working on strengthening. So that's to get guidance professionally, but you could certainly start with some basic things on your own. And yes, your bunions need to be corrected in order for you to even walk properly, because once you have bunions and the big toe starts to push to the midline, your push off is no longer properly done through the big toe. So it is important. All right, any other foot questions?
Coming back in, the next set of questions are on the next topic. So I'll let you do
Okay.
the footwear, and I'm going to bring you in because there's actually some interesting questions coming in on the chat, and I do want to bring those in. So I might surprise you with those, but I think you're fine. So let's just move on to the next topic, and then call me back in when you're ready to get those questions.
Okay. All right. So going from footwear makes sense to go to foot. From foot care, we're going to footwear. And so what you put on your feet often will dictate what your feet were like in the first place. Being one of 11 kids, I think part of my foot issues were that I got everybody else's shoes until they were totally worn down. And they often, my husband would always say this, you could always spot a physio by their shoes, because we generally, once we go to physical therapy school, start wearing more sensible shoes, as they say. So no high heels, no floppy slippers. We have been taught, even in physical therapy school, just to be mindful. And in our teaching, you don't wear slick soles, and going around barefooted is okay, but not with stocking feet, because especially if you have stairs or hardwood floors, it can get very slippery. So I guess the stocking feet with the little grippies underneath would be fine. So the recommendation, and this is just like a general recommendation, because obviously if your feet need more support and you wear orthotics, this isn't going to work for you, but the general consensus in the foot industry is sturdy, flat shoes, non-skid soles, and a wide foot box, because you want your toes to be able to stretch and do what they love to do and haven't been able to do, but they will get to do. Now, lace-up shoes are really important, but I know all my clients hate lace-up shoes because it means they have to lace them up. So instead, get lace-up shoes, but change the laces to an elastic lace, and just have your elastic lace so you don't have to, actually relace them every time and bend down, which is what people don't like to do, and use that with a shoehorn. That is my suggestion and recommendation. And again, if you have specific shoe needs, to seek out the help of a podiatrist or other foot specialists. Okay, that's it for me on.
Okay, I'm back. And so I'll start with...
Okay, surprise, what is it?
I'm sorry?
You said a surprise, I'm waiting.
Well, here you go. What kind of shoes are best? I've heard the standard walking or running shoe has too thick a sole to help you feel the ground well enough. And I'm going to stay on because there's some questions in the chat I'm going to bring in, if you don't mind. Okay,
so I'm going to try to keep this short. It's always hard for me. But in terms of soles, if you're just looking at the sole of the shoe, my understanding is the Vibram sole is one of the best one in terms of, they're great in terms of grip, but they're also good in terms of communicating to your foot. So they don't have as much of the cushioning, but rather more the ability to communicate. That would be one. And then two, looking for a more minimalist shoe. So if you take the shoe, that you're able to actually flex it, which would mean that your foot is able to flex. But again, if you've always been in a rigid shoe, this might be, a lot all at once, so you would want to gradually progress to something like that.
Good. I'm going to bring in a few questions from the chat, Margaret. Just bear with me. Where did that person go? Oh, here's one from Nikos. Does walking help, and what type is the most beneficial?
What? Does walking help?
Balance.
Oh, and what type of walking?
Yeah, we can. This is what Nikos is saying. I don't know. I
Okay.
apologize for putting you on the spot.
Okay. So does walking help? Actually, I was thinking about that as I was running up the hills this morning, and I was thinking how, I'm really glad when people tell me they do 5,000 steps or 7,000 steps or 100, whatever, how many numbers of steps they do. But regular steps is just part of living. And regular steps don't necessarily help your balance if they're all slow and, you're watching your step every time. I mean, it's got, they're better than nothing. I mean, I'd rather you be stepping, but if you're always stepping the exact same way on the exact same surface at the exact same pace, it's not going to prepare your balance or prepare your body in any way for a time where life might require you to go a little bit faster because you're late for something, or to be walking on uneven ground because you're invited to a cottage, or it won't prepare you for if you always take a certain route and you avoid certain curbs or uneven surfaces. Those things are all part of balance. So I guess what type would be to switch up your balance, and again within reason of where you're at. So if you're in a nursing home, and you're using a walker, then you use your walker, go 30 more feet, but do it on the gravel or the uneven pavement outside the nursing home. That's a great start with somebody there with you. So you don't like go from A to Z and try to improve your balance, but just introducing different challenges will help improve your balance and help stimulate, because things are coming by. You have to move your eyes, you have to turn your head. All of those things help us with our balance, and so I hope that helps. Okay.
Thank you, Nikos. I'll actually. There's more questions, but there's not enough time. So what I'm going to do just to move forward.
Sorry.
I'll exit out here and move that question. And
I know I can talk too long on anything, but
beg your pardon?
it's because I visualize all my patients over the years, and I think of all their scenarios, and then they all come to mind. Sorry.
No, don't need to.
Okay, next one. Oh, so the next topic?
Well, yes, I'll just pass it back to you, Margaret.
Okay. So actually the next topic is eyes and vision care. And I was so surprised, when I was listening to the optometrists that were presenting on eye care and falls, that here in Canada, 1/3 of Canadians over 65 will have eye disease. And this eye disease will lead to some vision change. And that was like a surprising fact for me, actually. And then it was like 1/9 of those individuals, or of all Canadians, will have irreversible vision care. So as I see all my clients that come in, their primary source of balance information to the brain is their eyes. So with that information, I'm like, oh my God, everybody needs to be working on their proprioceptors and practicing, working with sunglasses on, or moving their eyes or closing their eyes, because they're going to be challenged to not be able to use their vision and be focused and forced to get more information from their proprioceptors. So with that, in a nutshell, so important. If you haven't had a comprehensive eye examination in the last 2 years, please get one. If there's a family history, and you're under the age of 50, with eye concerns, then you should definitely get one before you're the age of 65. Another one that's really important is glasses. And that's when it comes to eye care, so many people will wear bifocals or progressives and not realize how it impacts their ability to perceive depth perception. And that's really critical if you're walking downstairs or there's a change in the depth, because you won't actually realize that or see it accurately with the bifocals or progressives. And the other thing actually that was brought to my attention is, and I would never have thought of it, is the ability to read those little tiny prescription bottles. So if your vision is hindered, then request a low vision exam so that you can have the right tools to make sure that you can see things that are really, really important to see, especially if you're the person dispensing the medication in the household. So yeah, so all the typical things that as we age, cataracts, glaucoma, macular degeneration, diabetic retinopathy, and sometimes we can get strokes and we don't realize, mini strokes will actually affect the optic nerve. So many reasons to make sure you make a visit to the optometrist part of your healthy aging process. Okay, that's all I have to say.
Right. I'm back. Okay, so question related to vision care, or somewhat related. And this came in by our email list, so they submitted a few days ago. When walking the stairs to build bone, I look down to be sure of where I'm placing my feet. Does this affect my posture? And the second part of their question is, what is the safest way to walk concrete stairs?
So that question, because it did come in, that was the one that gave me the idea to talk about the depth perception for, so obviously ensuring that they have the right eyewear, if that's part of the routine. Just like I know you, Richard, you wear different glasses when you're behind the computer versus when when you're doing your athletics, those kind of things. So I don't wear glasses, so I can't speak to glasses as well, but having the right glasses for whatever you're partaking in. Now, in regards to stairs, the other thing would be to even look at the type of railing. And so when going up, sometimes, making sure you have a railing that you can actually grip as opposed to one that's really, really wide. That's harder to grip. Yes, looking down will affect your posture, but having a fall will affect your posture for a longer term. So if you have a good position sense and you feel comfortable, starting to bring your gaze up, then great. If not, just make sure that you stretch up and long and tall before and after you do your stairs. And certainly with concrete stairs, you definitely want to have some footwear with some shock absorption. And the Vibrant soles would be fine for that as well. That's all I can think of.
Well, I think you can move on now to the next subject because there's no more questions in here, and we'll keep it going.
Okay, awesome.
Okay, so I'll hand it back to you.
Okay, so, and that's great because I would like you all to be able to get on with your Saturday. So my goal is to have this wrapped up in the next 10 minutes. So this topic is really important, but medications and the increased fall risk in medications. So again, huge as a category. And so my first recommendation is, even if you're taking an over-the-counter medication, please speak to the pharmacist. Just say, I'm thinking, my hip's bothering me more, so I've been taking this Tylenol. Is that okay? Because it might say on the Tylenol bottle that, you can take up to 4 grams a day, 4 tablets a day. But that medication was tested on healthy, robust 25-year-old, usually men, with a lot more muscle content than we have when we get older. And so because our muscle content is different, our body water is different, our protein is different, and even our fat, the amount of fat we have in the body, all of those things will affect whether a medication that is fat soluble or water soluble or protein soluble, how long they stay in your body, whether or not they're going to lead to toxicity faster in your body. So that's why, I can't even remember the list, so that's why I had to write them down. So that's why you absolutely should talk to your pharmacist. But some of the things that came out just in the last week in regards to increasing fall risk was, the daily aspirin that they were saying, people should take over the age of 70 for reducing heart issues. Well, it appears that when they looked at, 70,000 Caucasian Australians that were studied, those that were given a placebo versus those given a little baby aspirin over a period of a number of years, 4.5 years, I think, was the trial duration. And they had almost a 10% increased risk of falls, those that were on the little baby aspirin. So that was surprising. Non-steroidal anti-inflammatories do increase the risk of falls. Anticonvulsant medications, I know a lot of people aren't on anticonvulsants for seizures, but they're often given them for nerve pain. So meds like gabapentin and pregabalin. And then you have your common ones, antidepressants. They increase your risk for falls. Or all the opioids do. The muscle relaxants do. And cannabinoids. So especially, since it's been legalized, it's, people are trying them, but they do have increased fall risk. So those are the key ones in the medications. And yeah, that's all I have to share on medications. So if there's any questions that come in, I'm probably not the best person to answer it, but Richard, anything on that before I move?
There's nothing on medication that's come up, but there is something on the next topic. So do you want that question, or you want to do your topic first?
Well, my next topic is, I don't know, making sure we're on the same wavelength, is medical health, like
Right.
right?
This is medical conditions.
Thank you.
You're welcome. So do you want to chit chat about that, cover that for
On
the
medical conditions? Sure, yeah.
And
Well,
then I'll come back in with
throw
a
your
good
question out first. Go for it.
You want the question first?
Yeah.
Okay. So the question that fits in that category is, do you have any suggestions for people who feel off balance because they really are off balance permanently? In my case, it's congenital scoliosis, but others may have old injuries that make their posture or perfect posture an unrealistic goal for them.
So I would have to correct that person in that they have a perfect posture within their body. They won't have a perfect posture in comparison to somebody who doesn't have scoliosis. But as an example, my niece who has scoliosis came and spent 2 weeks with me to work with another therapist who does scoliosis training so that she could optimize her posture and optimize her muscle strength to help her best use her body. She needed to be strong with the type of work she does. She now just had a baby, so she needs to be strong with her baby, all those things. So your posture, whether it be from scoliosis, whether it be from having a stroke and being paralyzed, whether it be from being born with, 2 limbs. I mean, everybody has their challenges, but within that, because I've worked in spinal cord, I've worked in stroke rehab, worked in orthopedic surgeries, in burns. People are left with all sorts of different challenges, but we can still optimize what their body can do within the limitations that they are facing. And so, finding a healthcare professional, a physical therapist who's just really good at that area, they're out there. I've worked with many of them. And, when you're an amputee, you have to change, where your center of gravity is. There's lots of challenges, but you see, amputees do amazing, athletics. So I hope that helps, and I hope you're able to find a healthcare professional that helps you with your scoliosis.
Okay, so Margaret, if you want, I can I think you need a little bit of a break if you don't mind, and I can cover a few things for the audience.
Yes, please.
Can I do that?
Yep, it's water.
Okay, so I'm going to take over for a minute here and remove this. So just what's happened of recent is that we've achieved a milestone with our YouTube channel. I very much appreciate and want to thank everybody that supported us. We bypassed 100,000 subscribers, which is a fairly significant feat for us at least, and it can only be done with the help that you provided for us, and we very much appreciate the support. For us, what's really important is that we get Margaret's information out to as many people as possible, and we try to help as many people as we possibly can in these times. We can't provide individual support to people on a one-by-one basis, not on a large scale. We can with a small set of individuals, but when it comes to just getting really high quality information that's medically sound, that's really our passion. So it's really about educating you as an audience. And again, we very much appreciate your support over the last number of years as we've grown. We did receive a little award here from Mr. YouTube, and the CEO wrote us a nice letter just saying congratulating us for 100,000 subscribers. So just a small token, and we very much appreciate that. The other thing I might want to cover, and I hope this works and might work, I think a lot of people would benefit if I just show a few of the resources available that we provide for them. So I'm going to do a share of screen, and what I'll do here is, okay, I'll share the screen here so you can see it. And there it is there. Oops, just looking at my whole screen. So, but over here you see, I'd encourage you to go to our YouTube channel. In there we have about over 500 videos. So if you click over to videos, you'll see that, and you can search. There's a search box that YouTube provides, and many people don't know about, and just search on a term. I know a question came in on knee pain. We actually did a series on knee pain. In fact, there's one of them there. So again, search on a term, you'll probably find an answer to something there. Another resource that we provide is our learning. Now this is paid, this is on our website, and it's under learn.miliaguide.com. But many of our courses and our workouts are here. Key one we have is perfect posture, but we've also introduced a number of other ones. We have weight-bearing workouts for people. We have strength training, which is a combination stuff, yoga, and also we have courses for individuals. One we did recently and released was on compression fractures right here. So we have a wide range there. And then finally, I'd encourage people who can just go to our website, which is miliaguide.com. And if you just scroll down, you'll find a number of guides here. And one is on balance exercises. So you can go to that one. It's pretty rich. It's got a lot of free content that you can get access to, which again links back to our website. So with that, I will go back here. And it's a quick summary. And again, I want to thank everybody who's attending today, and also all the support you provided over the last number of years for us. And with that, I will bring in Margaret, and she will, hopefully she's had time to catch her breath and is ready for the next topic, which I believe is home safety. Is that correct, Margaret?
Yes, and I decided, it's just too long. So.
Okay. I'll let you decide. Whatever you start speaking about, I'll bring up the banner.
Yeah, so home safety, in a nutshell, start to look around, start to look at your home in a way differently, that if you said, wow, if I was inviting a friend that I knew had balance issues, because sometimes we don't see ourselves in that way, but to start to go, wow, would I have them climb them up on the chair to reach into the cupboard? No, I probably should get a step stool with a handle. Maybe, it wouldn't be safe for them to just go into the shower without a grab bar. Maybe that would be helpful for me. Things that would be really helpful. There's so many resources on safety in the home. So I really encourage you. You can also even have occupational therapists, by the way, go into your home and do a thorough assessment of your home. And they will give you a whole list of recommendations and often recommend the exact devices that you need. So certainly if you are considering aging in your home, that is a great, great thing to do. And then the last thing actually I want to mention is, I don't know that we did any title on that one, but is assistive devices, because so often I have clients that come and they're limping, or I test their balance and their balance is dangerously low. And I recommend assistive devices, be it, loft strand crutches, be it Nordic poles, be it activator poles. When our balance is poor, hanging on to furniture to get around your house is just a dangerous thing to do. And not only is it dangerous, your gait is now totally changed, your posture is totally changed. It is not a functional way to get through your home. So, please work with your local therapists. So many of my clients will say to me, but I don't like to look old. I never wanted to be the person walking with an assistive device. But yet, if they saw themselves walking, they would realize how much worse they look. So, but you know what? Today, everybody's on their devices. Nobody's even looking at you. You hope they would if you fell, But don't worry about what anybody, is thinking. Just think about making sure that you're staying safe, that you're using whatever device you need to use to stay absolutely safe. And if your body doesn't need that device anymore, it will stop using it. You will always, you'll have been using a crutch and then you go, oh, I got up without it. I didn't even need it. Because you will be, if you're working on your balance independent of using assistive devices, your balance will get better. Your proprioceptors will be working better. Your strength will improve. Those things can happen, but in the meantime, please keep yourself safe. And so if you are concerned about your own personal safety or that of someone you love, please check with your local hospital, your doctor, Google fall risk assessment in your town or fall screening, or look for a fall prevention clinic. But, I hope that you, take the measures that you need to stay safe and to prevent a fall as you age. And I just want to thank you for joining me today. Thank you for taking time out of your week to stay safe.
Margaret, I think there's another one or two more questions if you don't mind, unless you have somewhere to go.
No, go ahead. I'm looking at the weather. Nah, that's okay.
Okay, you should have told me beforehand you had an appointment somewhere else, but.
No, don't.
Okay, great. So I think there's actually a couple of questions that have come in that I'd like to cover. And so I'll actually, if you don't mind, I'll stay with you as you answer them. So you'll be looking at me. And this is to do with assistive devices and a few more questions. We'll close with that. The one with the assistive devices, which I think is probably appropriate. Question is, can using a cane routinely actually lessen your natural balance?
Okay, so this is a husband thing, I think, honey, because I thought I answered that question indirectly in what I just last said, but I'll say it again, because I was saying when I was talking about assistive devices, if you're using it and your body doesn't need it anymore, you won't feel the need for it. You'll actually get up and walk across the room and go, oh my gosh, I walked across the room. Like little babies when they're holding onto furniture to start, when they're just learning to walk, and all of a sudden they walk across the room and everybody's like, oh my God. The same thing happens in rehabilitation when, people would wheel in and then they'd go to the plinth, and then all of a sudden it's like, oh my God, they walk there because their body's able to do it. So if your body needs the cane, and the cane should only be used for balance assistance, not for leaning on, as long as you keep working on all the other components, your strength and your balance, your body's not going to lose those things. And you'll be able to gain them and still have the protectiveness of the assistive device when you're out in the community.
Great, thanks, Margaret.
Yep.
Two more questions, but before I go to that question, was that comment about the husband, is that referring to me? Was that directed? Okay.
No, I think everybody else's husband.
Okay.
Not you.
Okay. I'll just take one in. I'm going to put you on the spot here with two. It's the last two. So this one is related to, I think, assistive devices, and it is, what is an activator pole, from Kathleen Cannon.
Oh, okay. Well, you can go up to urbanpolling.com and you will find the activator poles there. They are designed by an occupational therapist in British Columbia. Mandy is passionate about what she does in urban polling. The activator pole is very, very similar to an urban pole, which is basically a walking pole that has a wide base, like a cane tip base. It has a locking mechanism like a cane would. It has the capacity of putting 600 pounds through it. And it has a really clever design that she had engineered so that the shock absorption of the activator pole is not felt in your wrist and your shoulder, but rather through the funny looking sort of bell top rubber of the handle. And so that's what an activator pole is.
Great, thank you. There's an interesting comment here. I just want to point it out here. Good answer about the husbands. So from Louise. Thank you, Louise. Okay, last question, Margaret. I'll throw it at you if you don't mind. And it came in not on the chat, but on the request for questions, and from Catherine Nolan. So, is it still a good idea to continue doing balance exercises such as tree poses in yoga while holding on to something for support? You still get the benefit of the balance exercise when you're supporting yourself.
So if you're doing that and it's challenging you, then you're getting the benefit. But if you're doing it and you don't feel any challenge and you could stay there for easily over 30 seconds, it's not challenging your proprioceptors. Hence, if you were asking me how you would progress specifically from that, you would have a couple of options. But the likely one would be, instead of holding on to something firmly, it would just be to start just putting your fingertip on it, so that you actually have to deal with, not leaning on it, but actually the sway that your body's dealing with. And then it would be progressing to having your hand just above it. The other way that you could train your proprioceptors is do the exact same thing, lightly holding onto it, and then looking side to side, up and down. All the things that I introduce into the YouTube videos that you see on balance work.
Great. So I think I got something mixed up when I did my little presentation. I just want to fix it. And what do I want to do here? So I'll spend a moment on this if you don't mind. I'm sorry, and I apologize. I had not done the screen properly, but here you can see this is the our YouTube channel again. I kind of cut the screen off. So we have lots of resources up there. And of course, it's all free, except for you have to go through the ads, but so be it. The next thing and then is we have, oops. So the other thing is, so again, I apologize that I cut off the screen, but coming back to this, again, I encourage you to look at other resources. Again, when the thing gets finally posted, we will put the video we'll post it in the description box with all the links and references that you can refer to. Sorry, I'm stumbling over my words because of multitasking here. Anyway, with that, we're at the 1 hour mark. Again, I want to thank everybody. There's been so many questions and so many very nice comments, and I very much appreciate people seeing someone here, Sue from New Zealand. And it's just really great to get these kind of warm comments from people and the support you get. So just the opportunity to interact with you is really, really wonderful for both of us. So with that, I'm going to say, I'm going to hand it to Margaret and she can say her final goodbye. Again, this will be posted. And please come join our mail list and join us, subscribe to us on YouTube, and keep following us, and we'll keep moving our message forward.
So, Rich is my business guy, as you can tell, and but for each and every one of you, I do, because I'll start crying if I start thinking about everybody's situation sometimes. But I really sincerely want you to stay safe and make time to take good care of yourselves. So, all right, we're done. Bye, everyone. Thank you for tuning in. Love you all.